Bismillahirrahmanirrahim. Rabbi zidni ilma. Small steps in the right direction can out to be the biggest step of your life. Assalamu alaikum everyone. My name is Dr. Sadir Rafiq and under the supervision of Professor Sara Afzal. Today, my topic of presentation is health sector reforms. Learning outline includes the reform outside the healthcare system, reforms within the healthcare system, the gateway health policy scaffold, the reform agenda. At the end of this presentation, the participants will be able to describe the reform outside and within the healthcare systems and the reform agenda. Starting with reform outside the healthcare system, it includes the structural reform of the state and health, second, social policy reform and health. First, structural reforms of the state and health. Health reform is not a sectoral phenomenon. Health has related policy, regulatory, institutional, and legislative dimensions. Health reform is deeply interlinked with the macroeconomic management, effectiveness of governance at state level, and social sector processes. These factors have more sustained impact as compared to isolated planning within health sector. Structural reforms of state governance has significant effect on the performance of health system. The need is to bring about improvements in the public financial management and procurement, civil services, and audit system. Pakistan has started many initiatives to assist with systemic reforms. The evolution of government initiative of 2001 include A. E-governance initiative, automation of Central Board of Revenue, electronic procurement reforms, and reform initiatives of Public Service Commission. Important aspects of state reforms. Promotion of transparency in order to counter the well-institutionalized pattern of corruption, which includes corruption practices and lack of effective accountability mechanism by anti-corruption reforms. And anti-corruption reform is a huge agenda and can be categorized into planning strategically and reviving the dormant national anti-corruption strategy. Second, bridge gaps in institutional mechanism relevant to anti-corruption reform. Mechanism of public redress exists in the form of ombudsman office but have a narrow mandate. Oversight institutions include the Public Accounts Committee and an Auditor General Department needs to be strengthened as a tool of accountability. In relation to investigate work, National Accountability Bureau is transformed into Accountability Commission. This new institution should be strengthened to engage the impartial pursuits. To institutionalize integrity promoting measures in the public sector to promote transparency and governance. In case of access to justice project, the project to improve financial reporting and auditing and other similar effects. Certain implicit transparency building measures should be prioritized. The use of technology can enable plugging leakages from system, obviating unauthorized payments, and promoting transparency in procurements. To focus on disclosure and build safeguards against conflict of interest in civil actions, judiciary, and political party finance. Reforms of political institutions, strengthening system of judicial redress, mechanism of civil society oversight, ensuring freedom of information and an open media. It is the impact of broader governance reform on the reform within a health sector. As you can see, there's macroeconomic reform, tax reform, and fiscal responsibility and debt limitation. By the macroeconomic reforms, it leads to growth, it leads to job creation and income supplementation, improve social determinants of health. And the tax reforms lead to increase in fiscal space, which leads to increased resource for the health sector, and further it leads to improved performance of the health system. Along with the above three, the civil services and public management reforms leads to improved utilization, then the anti-corruption reforms plugging pilferages, and the health system reforms. All this leads to improved performance of the health system, and ultimately the outcome is improved health status. Social policy reform and health. Social policy and health outcome. The Commission on Social Determinants has firmly established that inequities in daily living conditions and inequitable distribution of power, money, and resources are amongst the most important determinants of health status achievements. Social policy construct and its social impact is through a variety of pathways are given below. Health has a direct correlation with poverty, illiteracy, and inequities in society. Well-established best determinant of health status achievement is the level of per capita income. Much of the scope of public health workers is conventionally outside medical care, including provision of clean water, solid waste disposal, ensuring food security, occupational health and safety, safe working and living environment, securing safe neighborhood, and health status achievement, but not within the remit of health sector. Within the healthcare system itself, particularly the mixed health system, the role of state in health can be reinforced if it acts as intersectorally to ensure that health is delivered as a common good, not as market commodity. In Pakistan, 73.38 population is not covered for health, and they spend out of pocket. Health shocks are the commonest catastrophic faced by the poor households in Pakistan. As you can see, the prevalence of different categories of shock, the natural calamities, agriculture shocks, economic shocks, law and order, family matters, and health sectors. These are the different percentages are given faced by households. It is clear that a focus on health sector alone to improve health outcome is not good enough. The potential to address these issues through comprehensive development initiatives fall within the rubric of social policy. Social policy, a part of public policy that deals with social issues, is central to politics and the affairs of the state and one of the major responsibilities of government. In public policy domain to formulate macroeconomic, foreign and defense policy, the social policy domain often remains fragmented despite the existence of individual components of social policy in health, education, environment, population, and other programs as in Pakistan. The conventional domains of social policy, as you can see, area services are health, education, housing, environment, and population. Infrastructure includes the water and sanitation and basic physical infrastructure. Then the social protection programs, which includes the publicly funded safety nets and cash transfers, individual financial assistance schemes, food support schemes, labor welfare schemes, subsidies on wheat and other items, private assistance and charity unemployment benefits. And income includes the pensions, microcredits, unskilled low-wage employment public schemes. For a social policy, key issues are Pakistan has range of policy instruments which constitute the individual element of social policy, including housing, labor protection, environment, education, and health. However, it does not have an overarching and consolidating social policy embodied within a social justice framework. Pakistan's social protection strategy by Ministry of Social Welfare stating that government's obligation to chart a social policy has been fulfilled or by referring to social sector programs and delivery of services. In view of all this consideration, to develop consolidated and all-encompassing social policy embodied in social justice framework, to mandate overall responsibility for implementing a coherent policy to an organization and entity, existing issue with current social service delivery arrangements merit urgent attention. Foremost is the need of bringing clarity to the means of delivering social services. And last, the base of existing social protection arrangement should be broadened. Next come the reforms within the healthcare system. It includes the policy reforms, institutional reforms, and legislative reforms. First, policy reforms. The agenda for health sector reforms articulated in the National Health Policy of 2001 has been subject of controversy because of major gaps and deficiencies in its formulation as well as its content, conceptually and programmatically. These include absence of contemporary and local situated vision to ensure health for all in Pakistan's health system, lack of attention in health system domains and intersectoral perspectives, disconnect from burden of disease and other pressing public health imperatives. Gateway Health Policy Scaffold. In 2006, Hart files Gateway paper and its health system-based conceptual design a new vision for health policy. Based on this framework, a multi-stakeholders consultation process led by the NGO was initialized. Consultations deliberately on the draft of the National Health Policy entitled the Gateway Health Policy Scaffold. The objectives of scaffold included as guiding framework for health in the poverty reduction strategy paper to Pakistan. The scaffold has been made available to the Ministry of Health to serve as framework for the new health policy. The Gateway Health Policy Scaffold differs from previous policies with respect of four attributes that have been suggested for policy analysis. It includes context, content, actors, and the process of policy implementation. The broad goals of this policy reforms within the four following 8 domains include the evidence and information, health in all policies, health promotion, leadership and governance, health financing, service delivery, health workforce, medicine, products, and technologies. The scaffold has attempted to bring coherence to a diverse set of issues by formulating health policy. As such, it remains a framework document and needs to be built upon further into a tangible targets and planning instruments. If we see the key directions for health service delivery and financing reforms, as you can see, there's governance, umbrella of the governance, which leads to financing, and there's public and private methods. In public, there is revenue and pooling. In private, out-of-pocket payment, because 73.36% are not covered for the health, and they buy out-of-pocket payments. Then the service provision. This is public and private, which are interconnected with each other, incentivizing directly managed services using private sector principles, then contracting out with oversight, market harnessing regulation to increase first point of contact in primary healthcare. And these are basically interlinked with each other. Second comes the, after policy reform, institutional reforms. Within Pakistan, agencies in health-related role included Federal Ministry of Health, the Provisional Departments of Health, Offices of Executive, District Officers Health. Focus on the following dimension. Stewardship agencies, which includes the Ministry and Department of Health, decentralization, devolution of administrative powers, and the organizational entities in relation to implementing or regulating agencies. These are the roles and responsibilities of the Ministry of Health. First, the roles and responsibility, then comes the gaps, and next is the possible outcomes. So what is the roles and responsibilities of the Ministries of Health are? Policy making, norms and standard setting, planning and coordination, information and evidence, international health regulations. Then comes the public health, intersectoral coordination, regulation and oversight, stewardship of autonomous and attached agencies, fostering transparency and broader legislative agenda. Second is those that are not the mandate of Ministry of Health. These are the managing of federal hospital, operational control of public health programs, operational controls of autonomous and regulatory agencies, and lack of separation between policy making and regulatory and implementation roles. Legislative reforms, overarching health legislation. Pakistan doesn't have overarching legislation in health. The need to explore the feasibility of promulgating a National Health Act in Pakistan in view of currently prevailing ambiguities in relation to administrative roles, responsibilities in a decentralized health system, and paucity of guidance of public-private partnership. So the next comes is public health legislation. It relates to individual behavior, society, or to safeguards and standards relevant to water, sanitation, waste disposal, accidents, and injury, medical patients, epidemics, and other areas that needs to be regulated and controlled in order to protect health interests. Third is health system legislation. It is related to governance, service delivery, health financing, human resource, health information system, and medicine-related products. Health legislation, Pakistan current statutes and gaps. As you can see, there are different legislations, including the National Health Act doesn't exist. A local government ordinance was in 2001, then the service delivery, then the regulation, drug and placement. We have all the health legislation, the public health legislation, which was the ordinance in 1944 and lastly updated on December 2003. Moving further, there's a legislation for vaccination, tobacco legislation, then the consumer product, then mental health, occupational health, blood transfusions, blood food safety, environmental protection, breastfeeding, disease-specific public health laws. Next is the personal and product liability litigation and legislation. In 2006, the Supreme Court of Pakistan observed our constitution relating to fundamental rights of human being are given due importance. It is time to promote the law of tort so that people must understand that we cannot live as a nation without performing our duties within the framework of law. What is law of tort? Law of tort is the area of law or law that covers most civil suits. Concept is to redress a wrong done to a person and provide relief from the wrongful acts of others. There are also some legislation in the broader context of the consumer protection in Pakistan. Legislation of relevance to health is not fully developed in Pakistan. Reform agenda necessitates promulgations of law which can be unable to state to achieve its responsibility of delivering health. To achieve this object, health legislation must proceed in tandem with policy and institutional reform in health sector. The most critical challenge in health sector is not the absence of law, but poor implementation of existing laws. Next comes the reform agenda. The reform agenda is a set of actionable steps which can be implemented in a phased manner. Challenges in implementing reform process in Pakistan can be summarized as country's political law and order, geostrategic situation, current macroeconomic downturn, which is being rescued by International Monetary Fund, country's public sector institutional culture. Political consideration, tussles, and trade-offs which underpin the direction of reforms. No institutional memory or commitment to build and work in the pipeline and consolidate effects underway. Successive governments tend to adopt options while subsequent governments disregard them. These systemic flaws underscore the need to address these challenges, no matter what the cost and how difficult the course. The reform agenda priority areas. It has 5 priority areas. Number 1 is multi-stakeholders, which includes the development partners, establishment, civil society sign-up. Second is to address broader constraints within the remit of political economy and inequalities of power, money, and resources. Third is increasing the base of public sources of financing for health. Number 4 is market harnessing regulatory approaches for being flagged as a priority. And the 5 is the broader direction for reforming public and market service delivery arrangements should be complemented with additional layers. This is the reform agenda, a snapshot which includes the government, financing, service delivery, health-related human resource, and health information system. Medicine, products, and related technologies. This is all included in reform agenda. First, so the second phase of the reforming agenda is phase of implementation. It has different steps. Step 1 focuses on 2 measures, which are developing a national consensus on the reform agenda. Second is increasing public financing for health. Second step includes bracing the health information system and pulling a thread through existing evidence. Step 3 includes encompassing 3 important elements: strengthening institutional capacity, honing norms and standards, and mainstreaming the use of technology in the health system. Step 4 includes implementing appropriate changes in existing pilots, prototyping in key settings to develop best practice models, and the step 5 is should facilitate upskilling of prototypes. This is the phase-wise implementation of the reform agenda as we have discussed: step 1, step 2, step 3, step 4, and step 5. Implementation of multidimensional nature of the reforms necessitates political will, perseverance, consistency of policy directions over time, resolve and capacity to cascade multidimensional changes into policies, laws, and institutional arrangements. Limited capacity, short-term outlook of government, lack of transparency in governments create impediments to institutionalization of these changes. This is my reference, Joke Bite by Dr. Sania Nishtar. Now moving towards the recent advances. It is the Punjab Health Sector Strategy, which is 2019 to 2028. The government of Punjab taking forward the intent of newly elected political leadership to reform and restructure Punjab Health Sector towards better performance has pursued the development of 10-year Punjab Health Sector Strategy, which is 2019 to 28. The strategic roadmap, being a basic requirement to the financial resource to intents, has been developed with valor and rigor. This strategy is a sequel to and is in the consonance with the achievements of gap filling out the previous health strategy, which was 2012 to 20, more as a result of post-18th Amendment of Pakistan and bifurcation of Health Department Punjab. The defined priorities of new political leaderships in the political head include patient safety and quality of care, infection control, hospital waste management, environment/One Health, health financing, and public-private partnership in the backdrop of 3 paradigms: biomedical, social, environmental, and lifestyle and behavioral contexts. These paradigms can be achieved unless the role of other government sectors, civil society organization, private sector, and community group is realized with their maximum mobilization. The government of Punjab underwent a course of extensive consultation and deliberation from national high-profile expert and in-house consultative process to bring the required consensus and thoroughness in making this health sector strategy fully owned and implementable under the able and understanding leadership of Minister of Health Punjab with Policy and Strategic Unit as the Secretary. The outcomes and objectives that emerge through this consultative processes are maternal and child health, MNCH, nutrition and family planning. Second is prevention health service, including communicable and non-communicable diseases, patient safety and quality of care, medicines and biomedical equipment, health management information system, health governance and accountability, human resource for health, health care financing and public-private partnerships, health disaster management and emergency medicine, and One Health, including environmental health. The situational analysis conducted prior to the development of the health strategy showed that the Punjab has several shortages in its basic health indicators pertaining to RMNCH, communicable and non-communicable profiles. These gaps have been dealt under the strategy to efficiently tackle these issues. Additionally, the mechanism towards achieving desired objective will require major interventions in governance and accountability, human resource cadre development, capacity building, accountability of shortages in specific cadres of human resource requirement, introduction of new concepts, and reforming the business of the health department toward this direction. The situation analysis also depicts that Punjab undertook major steps in the past to meet this end. However, these were in silo and counterproductive in setting a health system approaches. Further, governing health requires a synergetic set of policies and set of supported by structures and mechanisms that facilitates collaboration across all health sectors. Tackling this together with engagement of people would be defining factor for attaining success. This required ensuring intersectoral action that incorporation of health is in all approaches. These approaches not only emphasize improving the coordination and integration of government activities for health, but also by governing through collaborating, governing by engaging citizens, governing by robust regulation and regulatory mechanism, governing through independent agencies and expert bodies, and governing by adaptive policy, resilient structure, and oversight. Now it's time for the multiple choice questions. Question 1, success to reform in the healthcare system is dependent on a number of factors within and outside the healthcare system. What is healthcare reform? A, government bill to make sure children always receive healthcare, keeping healthcare affordable, accessible, and high quality, making healthcare free for public and providing medication, and focusing on disease prevention so the public can reduce healthcare costs.
A.
No, the correct answer is B, keeping healthcare affordable, accessible, and high quality. Structural reform of governance and systems of social welfare are important adjunct to reform within the healthcare system. Name 3 trends in healthcare reforms. Keeping health insurance private, offering free medical screening and reducing cost. B, streaming healthcare, keeping the public informed and focusing on disease prevention. C, enhancing technologies, getting rid of specialists and making medications affordable. And 4 is keeping up with workforce shortages, offering pay-for-service plans, and cutting out consultation fees. B is the correct answer, which is streaming healthcare, keeping the public informed and focusing on disease prevention. Question 3. Health reform is not a sectoral phenomenon. In addition to health-related policy, regulatory institution, and legislative measure, which of the following better management create additional fiscal space to spend more on health? A, effectiveness of governance, B, social sector processes, C, macroeconomic management, and D is political will.
A.
No, the correct answer
D.
is macroeconomic management. It leads to increased fiscal space, and then there's more pooling of funding, and government can then spend on health. So C is the correct answer, macroeconomic management. Question 4. To promote fiscal transparency in order to decrease pilferages from the system includes all except tax reforms, trade policies, promotion of foreign remittances, school health services, and legal and institutional measures.
D.
D is the correct answer, school health services. Health has a direct correlation with poverty, illiteracy, and inequities in society. Well-established best determinant of health status achievement is the level of indices related to population, indices related to hospital, per capita income, and environmental conditions.
A.
No, the correct answer is C, per capita income. Because I have said it's a direct with poverty, illiteracy, and inequity. So the per capita income is the answer. In mixed health system, roles are played by public and private providers. It covers 41.3 million, 26.62% of country's population. Remaining 73.3% of population is not fully covered for health and seeks care by insurance, out-of-pocket expenditures, reimbursement, and zakat.
B. Out of pocket.
B.
B is the correct answer, out-of-pocket expenditures. Question number 7. Despite the existence of mixed health system, Pakistan has failed to achieve health for all. The failure is due to the interplay of foreign determinants except inadequate state funding, burgeoning unregulated role of private sector, lack of transparency in governments, excellence in professionalism, and unethical marketing practices.
B.
Alpha.
D is the correct answer because all are the causes of failure except excellence and professionalism. Scaffold presented a vision for reforming Pakistan's health system and attempted to outline directions to change. Given below are all included in it except structural dimension, programmatic, political, institutional, or legislative. The correct answer is political. Remaining all are included in the scaffold VN. Everyone has to work for the welfare of people of Pakistan, but a person who is violating the law and constitution work against the welfare of people must understand that everyone should perform duties within the framework of law, and it is high time to promote law of ordinance, law of tort, law of contract, and law of judgment.
Law of ordinance.
No.
C.
B is the correct answer, law of tort. I have told you law of tort is the area of law that covers with civil suits, and it is usually the concept is to redress the wrong done to a person and if somebody else is doing wrong. So the law of tort. Public health legislation can relate to individual behavior, society, or to safeguard and standard relevant to water, sanitation, waste disposal, accident and injury, medical patent, epidemics, and other areas that need to be regulated and controlled in order to protect health interests. Public health ordinance was enacted in 1942, 43, 44, 45, 46.
46.
No, the correct answer is in 1944. This is Daki, and thank you so much.
Thank you, Dr. Sadia, for a comprehensive presentation. If anyone has any question, they can ask. I think we can end this meeting.
Okay, thank you so much.